Have you ever wondered how an extra electrical wire in the heart can cause a dangerously fast heartbeat? That's exactly what happens in Wolff-Parkinson-White, or Wpw syndrome. In the next 2 minutes, I'll explain what it is, how it happens, its ECG features, and the key treatment points. What is WPW? Wpw syndrome is a ventricular pre-excitation syndrome. Normally, electrical impulses travel from the atria to the ventricles through the AV node, which briefly slows the impulse to allow the ventricles to fill with blood. In Wpw syndrome, an extra electrical pathway called the bundle of Kent bypasses the AV node. As a result, part of the ventricle is activated earlier than normal. This is called pre-excitation. Now, why it happen? Because there are now two conduction pathways, the normal AV node and the accessory pathway, the electrical impulse can travel in a loop, known as a re-entry circuit. This can trigger episodes of paroxysmal supraventricular tachycardia, or AV reentrant tachycardia, causing sudden palpitations, dizziness, chest discomfort, or even syncope. Let's talk about ECG findings. The classic ECG findings in Wpw are easy to remember. Short PR interval because the AV node is bypassed. Delta wave, which is a slurred upstroke of the QRS complex due to early ventricular activation. Wide QRS complex because the ventricles are activated through both the accessory pathway and the normal conduction system. Now, what are the treatment options? If the patient is unstable, perform immediate synchronized cardioversion. For stable narrow complex tachycardia means SVT. Start with vagal maneuvers, followed by adenosine if needed. However, if the patient has atrial fibrillation with Wpw, never use AV nodal blocking drugs such as adenosine, verapamil, diltiazem, beta blockers, or digoxin. These drugs can increase conduction through the accessory pathway and may precipitate ventricular fibrillation. The definitive treatment is radiofrequency catheter ablation, which is curative in more than 95% of patients. If you found this video helpful, don't forget to like, subscribe, and share for more emergency medicine and ECG tutorials.